You're a physician or a nurse and you've recently developed a chronic medical illness or a handicap and it's making it hard for you to do your job. Perhaps you've lost the use of a limb or eyesight, or you developed a medical condition that's creating chronic fatigue or the need for intensive medications. And you're asking yourself, can I continue my career? How could I move on after this? Do I need to give up medicine and give up working? Dr. Gregory Charlop here, and I'm here to tell you, no, you don't need to give that stuff up. There are plenty of opportunities for you to work both within medicine and beyond medicine, even with a new disability or chronic illness. I'm the founder of the Physician Wellness Project, and I'm an expert in alternatives for doctors and nurses looking to do other types of jobs that are more fulfilling. Now, today I want to tell you how you can continue on with your career even with your newfound disability or illness. Now listen, I get it. Healthcare is very physically demanding. I understand how it is. You have to move patients around in gurneys and wheelchairs. You have to push through long 10, 12, 24-hour shifts that are very tiring. You're constantly needing to be on your A game because patients and your colleagues are depending on you. And I understand that it can be difficult to do all of these things with a newfound medical illness or disability, or even just with age, even just with time. And I get it. You could be tempted to retreat and retire. But I want to give you a ray of hope and hopefully tell you that there are other alternatives to this other than retiring and leaving your job. Now, let's look at a few angles here. First of all, your employer is required to give you reasonable accommodations so you can continue working. So let's say you've lost the use of a limb, or it's hard for you to work for more than a certain amount of time. Your employer should be able to switch your job or switch the environment to make it so you can continue working. Perhaps you won't have to push patients around, or maybe your shift lengths can be shortened, or maybe instead of working overnight, you would just work during the days when you're fresher. Or maybe you won't do direct patient care, but you'll do other tasks like teaching, case review, quality improvement, work on computers, for example, or creating protocols. There are so many ways that intelligent, hardworking people like you could deploy your talents, even with a handicap or disability. Or perhaps you may find that it's better to work fewer hours per week. Maybe your energy level is lower because of the medications you're taking, for example. If that's the case, you might need to cut back from 40 or 50 hours a week that you're doing now, and instead of quitting altogether, work 20, 24 hours a week. You may find that you could easily handle that. It's just a matter of experimenting to find what works for you. You may need to switch jobs within medicine. It is true that there may be some places, if you're working at a busy clinic, for example, and there's only a few colleagues there, that employer may have difficulty finding something else for you to do, but perhaps you could switch to an academic center or a hospital that has more job opportunities where you can keep working and you can find something that's a match for your specific situation. Now, let's say you've thought about this and you've just decided you can't work in medicine anymore. Even if you've given up the call, you've changed your hours, you've changed your work environment. Well, let me give you one other thought within medicine to think about, which is you might be able to switch your medical career altogether. So say you're a surgeon, for example. There may not be a way that you can keep operating with your newfound medical condition, but you could switch and become a psychiatrist, for example, or an internist. There are other things you could do within medicine. It may not take you that long to do it, or you could try doing telemedicine, for example, where you could stay at home and work around your schedule and your needs. Now, let's say you've tried all this and either that you don't think any of these will work, or you're not interested in staying in medicine anymore. Look, I get it. People's needs change, their situation changes. That still doesn't mean you need to retire, because there are plenty of non-medical careers you may want to consider if you're a nurse or a physician with a newfound handicap. For example, you could become a teacher. You could become a consultant for startups. There are plenty of startups looking for advice on people just like you. You could become an advisor. You can you could become a case reviewer for medical legal issues. You could become a speaker. There's huge demand for speakers with knowledge in healthcare, just like you. You could become a writer, author, an editor. You could be on TV. There are countless opportunities for medical leaders like you to do things, even with a handicap or chronic medical illness. I don't want you to feel like you need to give up working because you have new limitations. You don't. The world is open for you, and I can help show you the way to do it. Dr. Gregory Charlop here, the founder of the Physician Wellness Project. There's always hope. There's always new opportunities out there. Thank you for watching.